Welcome to our tutorial on health enrollment for members in myCalPERS. In this video, we'll review how to use your myCalPERS account to make changes to your CalPERS health benefits. We'll start by introducing our Search Health Plans tool, then review how to enroll in a new health plan, how to change your health plan, and how to add and delete a dependent. Since everything we're going to be discussing today happens in your myCalPERS account, let's quickly go over how to activate it if you haven't already done so. myCalPERS is your gateway to conducting business electronically with CalPERS and access real-time details about your CalPERS account. You access myCalPERS on the CalPERS website, www.calpers.ca.gov. You'll see the myCalPERS login button in the upper right-hand corner of the page. Selecting the myCalPERS login button brings you to the login page. Here you'll select the Active Members and Retirees button. If you've already registered for a myCalPERS account, log in with your username and password. If you haven't yet activated your account, select the Register Now button and follow the steps to activate your account. Once you have your username and password, return to this screen to log in. We'll start with a brief look at our Search Health Plans tool. Before you enroll in a new health plan, you'll want to know which health plan will work best for you. Use the Search Health Plans tool to research the plan coverage and benefits most important to you and your family. You can find the link to the tool in your myCalPERS account under the Health tab. To use the Search Health Plans tool, you'll need to agree to the terms of use. Accepting the terms of use brings you to the Search Criteria page. You'll need to enter your zip code, since not all health plans are available in all areas. Answer the rest of the questions and select the Search for Health Plans button. For more information on any of the items requested, you can select the blue question link. The system gives you the option of searching for your doctor. All the plans that are available in the zip code area display. You can compare premiums and benefits for up to 3 plans. Select the View Compare checkbox for the plans, then select the Compare Plans button at the bottom left to view the premiums, copays, and maximum number of visits. Now we'll go over how to enroll in a health plan. Before you enroll in a health plan, there are some steps you should take which will make the process go more smoothly. In addition to the Search Health Plans tool we just reviewed, you may want to look at these resources: the CalPERS Health Benefits Summary, the CalPERS Health Program Guide, the CalPERS Medicare Enrollment Guide, and CalPERS Health Premiums for Public Agencies. There's some information and documents you'll need to have ready for yourself and any dependents, including a spouse or registered domestic partner, and dependent children. Scrolling further down the page, you'll also see some information about loss of coverage, primary care physicians, and the Health Insurance Portability and Accountability Act. Once you've checked the box agreeing to the CalPERS Notice of Privacy Practices, you'll be able to start your enrollment. Enrolling outside of open enrollment requires a qualifying event. Select the appropriate event and then select Continue. Please note that changes made during open enrollment, which happens in the fall of each year, take effect January 1st of the new year. Changes made due to a qualifying event take effect the 1st of the following month. So even during open enrollment, you may want to use a qualifying event if you have one available. Note that over on the right side of the screen there are steps that show you where you are in the process. If you wish, you can search for and select your primary care physician. Please note that adding your primary care physician to your enrollment doesn't guarantee you'll be assigned to them. If you choose to do so, search for and select your primary care physician, scroll down to the bottom of the page, and select Save and Continue. Review your choice of primary care physician. If everything is correct, select Save and Continue. You'll have the opportunity to add dependents to your health plan. The system may provide you with a list of people to possibly add as dependents. For instance, if you had previously named your spouse as a beneficiary, their information will be in the system, so it may pre-populate them as a choice for your dependent. If not, you'll need to enter your dependent's information into the system. You can add a primary care physician for your dependent. As with adding a primary care physician for yourself, Adding a primary care physician to a dependent's enrollment doesn't guarantee that they'll be assigned to them. Review your dependent's information to make sure it's correct. You'll get a message confirming you've successfully added a dependent to your enrollment. You can then add more dependents if you need to. If you're a member of an association that has its own health plan, such as the Peace Officers Association of California, or PORAC, you can choose to enroll in their plan. The PORAC plan is available only to dues-paying members of that organization and their families. Here's where you'll choose your health plan. Then review your health plan selection. On this page, carefully review and verify the details of your enrollment. You'll need to sign and submit your application. Check the boxes next to "I agree to the following electronic signature agreement" and "I elect to enroll in a health plan," then select Save and Continue. If for some reason you don't want to sign and submit online, you can scroll further down this page and there's a link to the health enrollment forms. On this screen, you'll see a message that you've successfully submitted your request to enroll in a health plan. If you wish, you can print out a copy for your records. You may also get a message that will require additional documentation to complete your enrollment. If so, you can scroll down a bit further on this page to upload any required documents. First, you have to select the enrollee in the drop-down box. Once that's done, the document type drop-down will populate. Select the type of document, then navigate to the document's location on your computer, then select Send Document. You'll then get a message that you've successfully submitted your document. If you made a mistake, simply repeat the upload process for the correct document in the Make a Mistake section. When you're finished, select the I'm Done button. Finally, you'll get a message stating that you've finished submitting your enrollment request. You can also review the details of the application on this page. Select the Print a Copy of this request link to save a soft copy or print your enrollment details. Next, let's review how to change your health plan. To change your health plan, navigate to the Health Summary page. You'll find the link under the Health tab. To change your health plan, once you're on the Health Summary page, scroll down past the Manage Your Health sections to the Current Health Coverage section. Select the Change Your Health Plan button. Changing your health plan outside of open enrollment requires a qualifying event. Moving is a qualifying event, as is joining an association that offers its own health plan. For this example, we'll select I became a member of an association. If you select I moved as your qualifying event, and the system hasn't registered a change of address within 60 days, you'll get an error message and won't be able to proceed. Again, please note that the changes made during open enrollment, which happens in the fall of each year, take effect January 1st of the new year. Changes made due to a qualifying event take effect during the first of the following month. So even during open enrollment, you may want to use a qualifying event if you have one available. Select the appropriate association, such as the Peace Officers Research Association, or PORAC. Select your new health plan, then scroll down and select the Continue button. Review your changes to make sure they're correct. To submit your health plan change, you need to complete the electronic signature agreement. Select the checkbox next to the statement, I agree to the following electronic signature agreement, then scroll further down the page and also check the box next to, I elect to change my health plan, then select the Sign and Submit button. If you don't want to sign and submit online, you can print out the Change Your Health Plan forms and submit them to your employer. After you've selected the Sign and Submit button, you're returned to the Health Summary screen, where you'll see a message that you've successfully submitted your request to change your health plan. Next, we will review how to add a dependent onto your health plan. From your home page in myCalPERS, select Health Summary under the Health tab. Once on the Health Summary page, scroll down past the Current Health Coverage section to the Subscriber and Dependents section. Select the Add a Dependent button. If it's outside of open enrollment, you'll need a qualifying event to enroll a new dependent. Select the drop-down arrow under Select Qualifying Event to see a list of possibilities. Make your selection, input the date the event occurred, then select Continue. And again, please note that changes made during open enrollment, which happens in the fall each year, take effect January 1st of the new year. Changes made due to a qualifying event take effect the first of the following month. So even during open enrollment, you may want to use a qualifying event if you have one available. You may have existing relationships in the myCalPERS system that are eligible for enrollment as healthcare dependents. If so, you can select one of them, or you can add a new dependent into the system. For this demonstration, we'll add a new dependent. On the Add New Dependent screen, you'll input your dependent's personal information, which can vary depending on the type of dependent you're enrolling. When you've finished, select Continue. Review the information for your dependent. If you need to make a change, select the blue back link at the upper left of the screen. If everything is correct, select Continue. Review your added dependent, then select Continue. To finish your request to add a dependent, you need to complete the electronic signature agreement. First, select the checkbox next to I agree to the following electronic signature agreement, then scroll further down the page and also check the box next to I agree to the health enrollment change request. Then select the Sign and Submit button. The next screen shows a message that you've successfully submitted your request to add a health dependent. You may need to submit documents for us to complete your request. Scroll a little further down this page to upload your required documents. Select the enrollee from the drop-down list. Once you select the enrollee, you'll have the option to choose the document type. Select the Choose File button to navigate to the location of the document on your computer. Once it's uploaded, select the Send Document button to complete the submission. Repeat this process for all the required documents. If you're not ready to submit your supporting documents, you can come back later to do so. Please note that we won't be able to complete the enrollment until all the required documents have been received. You'll get a success message once you've uploaded all the required documents. Select the I'm Done button. You'll be returned to the Health Summary page, where you'll see a notification that you've finished submitting your request. If you scroll further down the Health Summary page, you can review your pending transaction to add a dependent to your health plan. Now let's review how to delete a dependent. To begin the process of deleting a dependent, once you're on your myCalPERS homepage, select the Health Summary link under the Health tab. Once on the Health Summary page, scroll down past the Manage Your Health and Current Health Coverage sections to the Subscriber and Dependent section, where you'll select the Remove a Dependent link. Deleting a dependent from your health coverage outside of open enrollment requires a qualifying event. Choose your qualifying event from the drop-down list under Select a Qualifying Event, enter the date of the event, then select the Continue button. If you're deleting a dependent for a reason not listed in the drop-down, you can submit an HBD-12 form to your health benefits officer. Choose the dependent to be deleted, then select the Continue button. Review your choices. If everything looks correct, select Continue. To complete your request to delete a dependent, you must complete the electronic signature agreement. Check the box next to I agree to the following electronic signature agreement, then scroll further down the page and check the box next to I agree to the health enrollment change request, then select the Sign and Submit button. You'll be returned to the Health Summary screen, where you'll see a message that you've successfully submitted your request to delete a dependent. There's nothing else you'll need to do to complete the deletion. This finishes your part of the process. This concludes our presentation. We hope this information has been helpful to you, and thank you for viewing.